are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people with receding gums. If you have receding gums, you have to hear what Dr. Chang has to say. It's called the pinhole technique. And with us, we have Dr. Chang. Dr. Chang, welcome to the program.
Hi, Randy.
Now, for people I have lots of questions about these receding gums, because especially, I guess, with people with cold sensitivity could benefit the most. But for people that don't know SC Dental Group, who's your typical patient, and what are the different procedures you do?
We see almost everybody from young age to the senior citizen. We do all phases of dentistry under one roof. We do family dentistry, cosmetic dentistry, implant dentistry, sleep apnea, and gum treatment, and laser treatment, and TMJ treatment.
Okay. Now, in your practices, they're stretched out all over Arizona?
Yes.
Is that right? And you have, 6 other dentists that work with you?
We have 6 locations with 7 associate dentists. We do provide all phases of dentistry.
Okay, good. Now, we had you on the program to talk about gum recession.
Yes.
I guess there's 2 ways to handle it. One is surgery, a surgical technique where you take from the roof of the mouth and then put it to fill in the gap. Or you could just pull it down with this new pinhole technique. Is that kind of how it is?
Yes, it is. Still, there are a lot of patients referred to periodontists for the gum recession. Most of the options given to patients is traditional connective tissue graft, which is taking piece of gum from the top of the mouth and put it in where the recession is. But patient will not like it because it's painful, and also it takes long time to heal. Okay. And there is a new procedure called PST, pinhole surgical technique, which is very almost non-invasive and almost no pain, and heals very quickly, almost in 24 hours.
Are there a lot of people with receding gums?
Yes. Believe it or not, more than half of our adult patients coming to my practice, we diagnosing gum recession.
So lots of gum recession.
Oh, yeah.
What's the problem with gum recession? I mean, aside from that it doesn't look good.
Oh, it can cause a severe sensitivity, but the symptom varies from person to person. But it can be very sensitive to cold, air and water, and also cold food, just like ice cream. And also, patient can't even sleep well because of due to the pain.
Because it hurts.
That's right.
Now, does it always get worse and worse? That means once your gums start receding, do they always get worse?
Oh, yes. It will progress, and I never seen anybody get better by itself.
And what happens?
Eventually, if you're having receding gum, it's not under control, you might lose your tooth also. I have a patient coming to see me, and I look at and did the exam and have a lot of recession and generalized recession all over the mouth. And this person's worried about eventually lose all teeth. And I agree with that. If you're not under control, it's unprotected, you could have a premature loss of all your teeth.
And by the way, for people just tuning in, we're talking about receding gums. There's 2 ways to do it. Taking, I guess, grafts from the roof of the mouth.
Yes.
They surgically remove that and then put it on the receded area.
That's right.
Okay. So that's periodontists normally do this?
Yes.
Okay. So knowing you're coming on, I called one very well-known periodontist, heads up, in fact, at Temple University and Albert Einstein. He says, yeah, I went through the course and I do this pinhole technique. And so you're pulling down the gums rather than amputating, I guess, skin from another part to put it on there.
Yes.
So why, because logically to me it sounds very simple. Why isn't everybody doing this?
I think they are just happy with all the technique and knowledge, and some people open to the new technique slowly. And it depends on dentist attitude towards the new technology, and there should be one who research and should take the course to find out.
So there's very few dentists doing this technique, right, where you pull down the gums.
Right. about less than 1% dentists in the United States.
I mean, it requires a lot of training. Is that? 'Cause it seems pretty simple to me.
You need to know what you're doing, and this is something you cannot look at over the shoulder, and you have to be trained right so you do not create any problem. Such as there is we already take a CT scan to find out where is the nerves located at and where is the bone defects there. So we plan before the surgery and knowing where we are going and even be able to tell patient which area can get most benefit.
You say there's 5 different types of patients that could benefit from this pinhole technique that pulls down the gums. What are they? And let's talk about them one at a time.
Okay. For example, patient having gummy smile, always conscious about her smile line, and the gum line is so receding, they wouldn't want to smile big because they know it's very embarrassing. And there is also a type of patient who has orthodontically treated, and they result in recession. And even taking braces off, still the recession is not fully recovered. There's a patient who wouldn't want to smile because when they smile, they know there's a lot of gum recession showing, and
makes them look like they have long teeth.
Yeah, they make it look like a long teeth and aged looking, and so they try to hold their smile very unnatural. And also, first thing they say to doctor when we examine, please show me your smile. They still do not want to smile in front of me as well. So that's the type of patient we have. People who's going to cosmetic dentist, they get veneers done, but if they do have a gum recession, usually get their crown and veneer become longer because the cosmetic dentists try to cover this recessed area. And there is another solution. They could have a gum graft done and to make a size of the crown to be normal size. But there is a type of patient, they don't want to go through all this invasive surgery. So
the gum surgery.
Gum surgery. Therefore, they're ending up have a longer, unnatural, unproportional looking crown and veneer. A beautiful smile has also beautiful gum line, and it is more proportional, and has a certain ratio to the size of the tooth and also the position of the gum. It is gum line. It is a part of the good-looking smile.
You don't like gum surgery?
No.
Like the traditional gum surgery, I should say.
Yes, I don't like traditional gum surgery because it is invasive, and it takes quite a long healing time. And above 90% of cases, the traditional gum surgery can be done by new procedure called pinhole surgical technique, which is non-invasive, require no scalpel and no incision, and almost pain-free.
Like anything else, is it easier if you get them early? Like when
yes.
you're just starting to see the recession?
Yes, because this pinhole surgical technique, not only it does make your smile fuller and your gum is on normal position, but also it can be used as a preventive way to make a thinning of the gum to be thicker. So it can prevent future recession as a preventive way. And I've seen patients beginning to have a slight gum recession. Sometimes I tell patients there is a many different way to prevent more recession, but when it's starting to have a certain point, I do recommend doing a PST earlier can be more refined result. PST, this procedure can be done pinhole surgical technique.
Okay.
Pinhole surgical technique, it is using very special instruments to bring the gum tissue down, create a space, and also using body's natural way to repair itself. And by using strips of a collagen membrane, it can make it gum fuller and longer and younger looking.
For people just tuning in, we're talking about a new treatment option for people with receding gums. It's different than surgery where they take gum from the roof of your mouth, right? Is that where they take it?
Yes,
For the roof of the
usually
mouth?
they take
it there.
connective tissue from roof
And
of
then they
mouth.
plant it there.
Yes.
And then does it always look natural when they do it that way?
Oh, when it heals, I see the tissue doesn't look normal to previous tissue, like a texture and color slightly different.
Okay.
And it usually develops scar tissue, so it won't be natural looking at all.
You know, on this show, every once in a while,
Yes.
and people need to know it's a real interview, but that it's like one of these things that's a breakthrough.
Okay.
That across the country, people have gum recession and they're being given a choice of surgery. Now, I want to make sure I understand this correctly.
Yes.
Okay. So like drapes or curtains, your gums are kind of going up, maybe with brushing too hard or whatever.
Yes.
Right? They go up. So instead of just transplanting gums, you're just pulling the drapes down.
That's right.
How come they haven't figured this out before?
Obviously, it was a general dentist who invented this procedure, and a lot of periodontists are using their own paradigm and try to refine what they already had. But surprisingly, one of the general dentists, the one who developed and now trained a general dentist and periodontist in this procedure.
So if somebody walks in with
Yes.
receding gums,
Yes.
right, and maybe they have hot or they have cold sensitivity, they go in. On a moderate case, how soon do the gums come down, and how soon can the cold sensitivity go away?
I had one patient, happened to be a medical profession, a nurse, and she suffered from severe gum recession in one localized area, and she was having so much difficulty drinking cold water and even sucking cold air. And
Air made her.
air making me
hurt.
Yeah, I helped this patient by spending my half-hour lunch to lift the gum up, and patient was instantly covered this root exposure by this procedure. And then very same day, she realized when anesthetics went out, she no longer had a sensitivity to cold air and a cold food. It was amazing. And one of the medical professional is the one who praised this treatment by getting own treatment done during the lunchtime.
So this is very common.
Yes.
People with cold
Yes.
sensitivity on their teeth because of their receding gums.
Uh-huh.
And so the tooth root, if air touches it, it hurts.
Yes. Usually when this exposure, people actually brushing on top of it because the plaques getting attached to it, they want to get that area clean. By doing so, they're exposing more root surface. And the root surface is more wear out by toothbrushing, and sensitivity increase. And then it can easily get cavity as well, because unprotected root surface very prone to get cavity as well.
So just pull it down.
Yes.
It seems simple to me, and I keep saying the same thing. Okay, but why do you call it a pinhole technique?
Oh, instead of using scalpel or incision, we use very small 1/10 of an inch of needle to penetrate. We usually use two area, two teeth from the area affected, from the behind or front. So we go distal of two teeth behind or two teeth front. That way we can insert the instruments to detach the tissue and be able to manipulate the tissues down, and using special membrane, strip of membrane to hold it down. And also
So it stays down.
Stays down, and it is very stable. I've seen patients been having this surgery about 15 years ago, still stable. I actually met, actually talked, actually seen the result this inventor created. So it was a very, very good experience. It is, at the beginning, most of the dentists have a skepticism about this pinhole surgical technique. including myself. But when I actually saw the inventor was doing in front of me, actually I was doing it. More and more you're doing it, you'll be amazed how many people can benefit from this. That's one of the reasons I was so happy to be in your show, to let general public knows there is an alternative option available.
So no more gum recession.
Gum recession can be prevented and also recovered in many cases.
So the typical general, and help me understand this, because I know you want to be positive on this show.
Yes.
And the public needs to know that we're trying to be positive on the show. We're not saying anything about the negative about the periodontist or the gum specialist.
Yeah.
But traditional general dentists, if you have a lot of receding gums, okay, and you have this cold sensitivity, you told me, so for the patients that refuse surgery from the roof of their mouth to have a patch, that they'll put like filling material on the receded area to keep the cold liquids from the root. Is that true? And why is that wrong, in your opinion?
Oh, in my opinion, it is a lot natural to have your own gum to cover the recessed area rather than prepping the very sensitive root surface, adding tooth color material. That can result in even more hypersensitivity. It is only temporary patch up because this root exposure or gum recessed area, by adding this composite is not going to last long time, and also it's not looks natural, and tooth look way too long. It is unaesthetic, and also this could increase even more sensitivity on this exposed root area. So I do not recommend most of the cases. And when I do this pinhole surgical technique, I have to remove all this unnatural bonding to the root surface, and I have to bring these gums up with a natural root exposure area. And after that, patient may not need this all the filling anymore, or may still need a very small portion only after the gum surgery, after this pinhole surgical technique is performed. We bring it up as much as we could, and then if there is still defects created by overbrushing or cavity was already there, we could still have a small filling may require.
Okay. So dentists will watch this show, right? Because you're on here and they go, okay, there he is, Dr. Chang, because you have offices everywhere. But for the cosmetic dentist or the dentist that they have all these receding gum patients that are in pain, what do you want them to know about what you're doing?
Until dentists acquire this skill and being comfortable doing pinhole surgical technique, I would like to refer the patient have a root exposure gum recessed patient to us, so we can pull this gum as much as we can. Then this patient can be sent back to their own dentist to finish the restoration.
So you'll send them back to the cosmetic dentist or whatever.
And it'll be a lot more natural looking than just try to cover the root exposure area with this longer veneer, longer crown. It just doesn't look right, and it just doesn't function properly.
Okay, so I can only take your word for it with what you're saying, right? But could a dentist sit here and say, Randy, the problem with taking care of receding gums with this pinhole technique of pulling the gums down, the problem is that it's only when you only have a little bit of recession. Any truth to that?
No, that's not true. I had the experience of bringing gums down as much as a 5 to 6 millimeter gum recession. There's a limiting factor.
That's big though, that's good.
And in many cases, if the patient has a gum disease under control and there is enough height of the papillae between teeth, and we can bring it down as much as 3 millimeter from height of the papillae. So sometimes 5, 6, it could be more.
But you told me you also clean the gums with a laser.
Yes.
So you kill the bacterial infection.
Right.
Then you pull the gums down. Very, very interesting. Now, so no more cold sensitivity.
Oh, patients.
As far as you're considered.
I see many patients having instant relief from this cold sensitivity after the pinhole surgical technique.
And if you're just tuning in, we're talking about a new treatment option that less than 1% of dentists across the country, periodontists, they're treating gum recession with pulling down or transplanting, I guess, tissue from the roof of the mouth
Yes.
onto the receded area, right?
Yes.
And you're saying now with this new technique, you could, carefully put small pinhole
Yes.
Needles and pull down the gums,
Yes.
and they stay there.
They stay there, very stable. And it was a very, very clever idea using very small size of a pinhole, having this specially designed, invented special instrument designed by the inventor, and bring it down and without cutting any suturing. And those pinhole we created during the surgery will be almost invisible at the end of the surgery, or within 24 hours. You can't even find most of the cases.
What about pain? Because with the traditional surgery, you say there's pain in two places, the roof of the mouth, and then there's pain on the part where they had to transplant it. What about this?
Compared to the traditional surgery, this pinhole surgical technique patient, usually they take ibuprofen the day of the surgery, and the next day, many patients do not require to take any pain medication at all. Usually, 0 to 10 pain scale, I see many patients 0 or 1. So that means this is there's no downtime after this surgery. Unlike to the traditional surgery, patients saying they can go back to normal routine after this surgery. Normal traditional gum graft surgery, patient may ending up stay home 2-3 days and still having pain. It depends on the patient, but it can have up to the 2 weeks of pain. It's not small pain. It is very serious pain for 2 weeks.
Okay, now in the world of gum recession, because I don't even realize that it's out there.
Yes.
I guess these people are not smiling, right? Is that why I don't think it's out there? But do they normally just have like 1 or 2 areas that they need this to be pulled down, or is it all around the mouth?
Some patients do have a localized area, visible anterior area, smile line, but some patients having all over the mouth and
everywhere.
Everywhere. So they has to be diagnosed by dentist first.
So you are headed. I don't want to put words in your mouth, but if you have receding gums, you're headed for tooth loss. Is that true or not true?
It's true. If you are not treated as gum recession, they can possibly lead to bone loss and tooth loss as well. It's as simple as that. If you do not have a gum protect your own root surface, then your root, it can be easy to get cavity, and also gum disease can be more progressed. And with a combined effect, you can easily lose your teeth progressively, and it can possibly lose all your teeth as well.
Now, and we're out of time, but the sensitive toothpaste market.
Yes.
Do you have people that used to use that toothpaste and now they could use whatever they want?
Yes. They no longer require to take need to have a specific toothpaste.
A recap.
Yeah.
If you have receding gums, come in, get a consultation. And are your consultations free?
Yes, it's complimentary.
And how soon can you tell them I can do it?
First of all, the patient need to be thorough exam. We take an intraoral camera, and we need to borrow their full mouth X-ray to see whether the patient has gum disease or not, or existing bone loss. We address the issue. We try to find the causes of this gum recession, and we try to control this issue before we scheduling the patient. And also, we are using 3D cone beam CT scan to make sure we provide the right treatment on the right space, right sites, and patient will be educated and what the problem is and what can be done with this pinhole surgical technique.
We're out of time. Final message, somebody watching this, they have gum recession, cold sensitivity, but maybe they're watching this and they're still skeptical. Because they were told they needed surgery, traditional surgery. What do you want them to know? What do you tell them?
I would like to say those people who schedule or planning to have a surgery and try to look into this pinhole surgical technique. They can Google search from internet, and also or give us a call to set up the complimentary examination and also planning. And we can give you, compare all these options available. And I think this pinhole surgical technique can help majority of the gum graft candidate, but no scalpel, no incision, almost no pain can achieve this help recover gum loss.
Now, I have a cousin. We grew up together. He doesn't believe anything I say. And he goes, no, Randy, and he was defensive. Don't try to tell, it's after I talked to you. He said, don't try to tell me I don't need surgery. You're not a dentist. I go, well, at least get a second opinion.
Yes.
Because I tried to tell him you could pull down the gums.
Yes.
He goes, well, if that was true, the dentist I went to in LA would have told me. Is that common?
Yeah, it's common. It depends on the dentist's knowledge and their education, and also willingness to accept the new knowledge and test, and also doing some research on
Because
self.
very few dentists are doing this.
Before I doing my own patient, I offered my own staff as a candidate, volunteer, and
You did?
yes, when they get a good result, and it was just word spread.
So there's no receding gums in your office?
Almost none. And my job is also to make sure the patient coming to my office as a consultation, I would like to give the best advice I can. The patient can prevent further gum recession, and also alternative, doing almost pain-free pinhole surgical technique compared to traditional one.
Okay, good. All right, I want to thank you for coming on the program. Very interesting.
Thank you, Randy.
No more receding gums. All right, thank you so much. You've been watching the Wellness Hour. I'm Randy Alvarez for now. I wish you good health.